Dr. Sherri Greene, thank you so much for joining us on the Plant Trainers podcast today.
Wonderful to be here, Shashan. I'm very excited to chat with you all today.
We would love to know if you have a moment of gratitude to share with us and the listeners.
Absolutely. I think moments of gratitude these days are really vital, right? With everything that we're going through. So I think it's really, it's the simple things, really being grateful for friends and family in my life that staying connected, managing to stay connected with everybody, as well as just being really grateful that I can still be of service in this environment that we're all going through. So grateful for all the practitioners and people who are in service right now to be able to support people who are really struggling.
I agree. I agree that the doctors that are going into hospitals every day, into clinics every day, but also the ability for doctors to be doing telemedicine now, where it probably existed but wasn't as popular before, but now doctors and patients are comfortable doing it. And I think that it could save so much in terms of transportation and time management and all of that. And it's probably a very good thing.
It is, it is an adjustment for people and patients, for doctors, but now I think people have gotten more in the flow of it.
Do you think that once society gets back into a new normal, telemedicine is going to be a thing of the future?
I actually do. I do think it is going to be something that we're going to keep. I mean, there's things that obviously I need to see in person to be with them, to touch and feel and see. And then there's other things where it really makes it very accessible for people who are in more chronic states of being right now that need more. They can't really leave their house. They're afraid to leave their house, or they're just more reticent about kind of being protected, that we can get on a call through Zoom and really communicate and let that patient feel safe and looked after.
I have a lot of beauty marks all over my body, and one of them looked like it had changed colors. So of course I called the doctor in a panic, and I had to send pictures, and she referred me out. And when she referred me out, I had the telemedicine session with the referral, and she's like, "Oh, you've got to come in and we've got to biopsy that." And I was cool and I was calm, and I trust that I do everything in my life that whatever happens, everything will be okay in the end. Nothing's a silver bullet, but I've got the strength to get through whatever it is. And then I got there, she's like, "Oh, you can go home now." Because when she saw it with her own eyes in person, it was a lot different than it looked with my camera and my angle and the lighting and all of that. So you definitely do need to go in and see doctors as well. But there's lots of things and lots of check-ins that we can do this way, which is wonderful and great. We would love to hear a little bit about how you found the plant-based or vegan lifestyle and what kind of changed for you along the way.
Sure. Let's see. For me, it started a really long time ago of really getting curious about my patients. And I've been, trained surgically and just doing traditional medicine. And then I was noticing some people would get better quickly and some people would lag, and it just wouldn't, and there'd be no explanation of using same protocols with patients, and really trying to dig deeper in what was like the art of medicine and really understanding what goes into somebody's healing journey and what kind of trips them up sometimes and what other pieces came in. So there was a lot of things. There was a lot of mind body stuff, there was mental emotional things, but there was diet. That was a huge thing that weren't taught in school. And I was always into working out and exercising. And so I was into diet, but not in the way that was from a anti-inflammatory type of place. And so I started doing a lot of research, and I started taking classes and courses with different doctors and practitioners. And I started to incorporate little bits and pieces along the way. So I wasn't plant-based to begin with. It was more of anti-inflammatory type diets and what causes inflammation, what feeds inflammation, what can, bring it down. And then when my journey got really accelerated with my own chronic level of pain that I was dealing with things that I was just, there were certain things I was just like, oh, you know how people accept where they have different ailments, like say somebody doesn't sleep so well, or they have digestive things, they just think that's as good as it gets in their life, where they go and they get medication, or they delve deeper to find something else. So I think it really sort of happened along that trajectory of just going deeper and deeper and deeper into it, and exploring all different types of diets and using my own body as an experiment. And I ended up finding, like, getting into the raw food movement for a while. So I got very deep into that journey, which brought me further along, but it kind of hit a wall. And I wasn't doing it because there's a lot of ways of being a raw food vegan, right? So you can hit a wall and then think you've done it all wrong, and then you can kind of go back to what you were doing because you're like, okay, this doesn't work. So I went back to certain other things, putting back in my diet. And then really for me, it came, so in 2010, I was diagnosed with Lyme disease, and I had a history of IBS, which I really pretty much healed and got under control. But it was really I had really severe endometriosis, and that level of pain just brought me to my knees. And so there was that component that really led me to go, I got to figure out what this is about, and how to heal myself without needing to do more drugs, more surgeries, and not really get anywhere. And I needed to get to the root of that. So there was a lot of different pieces along the way, but that's really what took me more to back into that fully plant-based diet.
So then how did things change for you?
Oh, goodness. So many ways. You know, I would say that it changed for me, that my perspective on food and nutrition really shifted, and understanding the misinformation that's out there in so many different ways. It gave me a lot of things disappeared, like pain started to reduce, clarity of thought got better, digestion got increasingly improved over time. And I would say there was definitely an increase in sensitivity overall, you know, just spiritually, emotionally, physically, all levels. That's really what shifted for me.
So I'm so glad that things did shift for you, and I'm so glad that then you had a better understanding of plant-based nutrition and able to share it with your patients when they're ready to hear it on their own journeys. Do you think that, I mean, definitely it's a good thing that you tried the plant-based diet and it did work for you, but do you think that there's like a kind of scary waters that if some doctors are going to go ahead and try a plant-based diet and maybe not try it long enough or properly, or maybe still worry about portion control and calories on the plate at the same time, and then they might feel lethargic, they might not feel better? Do you think that, what do you have to say about that, where just because it didn't work for you as a doctor, not you in particular, does that mean that it won't work for your patients? There's scary waters there, right?
Well, there are. And you know, I didn't get better poof like that. It wasn't like that journey at all for me. And, you know, it's still an ongoing journey. And I think that, you know, I would say it's a great question, because that's really what I deal with patients all the time when we're working on different chronic conditions. Like, you know, no matter what it is, if it's Hashimoto's thyroiditis, if it is diabetes, if it's, you know, other neurological conditions, MS, it isn't something that turns around. It takes a long time for a disease state to build up. It can really take time for that to go away. So when I was going on this, and it was more of, when you've tried so many things, and even if it's not getting better right away, there's a level of trust and faith that you have to be able to say, you know, you start to look and you might have your doubts, and you go and you look in other directions, and like, maybe I'm not doing this right. And that's where I actually think a practitioner can be really helpful. Any guide, that's somebody that's done it and that's seen pitfalls, and that can help you find in your body what's wrong or what's missing, or if you're doing it, what needs to be tweaked a little bit for you or where you are today. So I think it's an interesting process that you have to, like what we talked about earlier, is like you meet people where they're at, and making small changes is better than just like full on just saying, okay, I quit this. I'm not going to be paleo and I'm going to go to vegan. Like, you can just do things really carefully, really gently with your own body, and teaching people to be the observer and to be more intuitive about their own body, and just being the watcher of what goes on, and trying not to get too confused along the way. And just a stepwise approach to it is I feel like best.
I like that you mentioned your sensitivity increases and you become more aware of everything. It seems everything that's happening around you or to you on so many different levels. And you mentioned before inflammation, and I want to come back to inflammation in a second, but it sounds like you went through a lot of different illnesses, I would call them, I guess, IBS, and you mentioned endometriosis, and there might be some listeners who don't know what endometriosis is. So can you just maybe explain that briefly for them?
Absolutely. So endometriosis is really when the lining of the uterus sort of sloughs off and goes into different directions, different areas of the body, and there can go outside the uterus, it can be on the ovaries, but it can go into the intestinal tract. It can go really anywhere in the body that can go. So it's it becomes this like inflammatory tissue, but there's a root cause to that, where it's not just you have inflammation and we don't understand. Most mainstream doctors don't understand what is the root cause. They think it's an autoimmune condition. And really, I'll just shout out thankful to Anthony William, medical medium, who's really put a lot of pieces together for a lot of doctors, for a lot of patients, to really understand what some of this root cause is. Because I had been to 5 different gynecologists and surgeries and hormones and all kinds of things like that, and nobody really understood like what was causing that for me. So once I really understood that there's only 2 things that cause inflammation, one is an injury, and then the other is viral. So that's really getting down to that, and how do you use food as medicine, and how can use supplements and herbs to be able to get somebody back on the right track.
So I want to continue on this a little bit more. What are some of the signs or symptoms that people might have to make them think endometriosis, I better look into this more, I better ask my doctors about it?
Right. So it really comes from, there are certain signs that you can have where, if you look from a medical perspective, is, a tilted uterus, a retrograde uterus, that type of thing. But you also have a lot of pain. It's really, but it really is the pain and the cramping that actually gets to a level of not just normal. I mean, menstrual cramps shouldn't be happening anyway, but when they get to a level that's escalated beyond 10 plus, like, you got to look around and see what else is going on. And you can only diagnose it from intraoperatively, to really see where the tissue is and what is. You can't look at it you can't really see. You could see uterus that's thickened and the lining of the uterus that's thickened, that usually comes along with this, but you can't, from a diagnostic perspective, it usually through a scope. But other than that, you can know from somebody's symptoms what they're experiencing. Heavy periods, things like that.
So does that mean that doctors might say, oh, you should go on birth control? Or what are some of the things that people may have gone through already with doctors and then it's still not working?
Right. Well, the interesting thing is, so I was diagnosed very early on because my mom had it. So they looked, were looking, and I had very painful periods very, very early on. And so you get put on birth control. And I was on birth control for 13 years. And it kind of kept things at bay. And then what happened was there were other things that came in, like Lyme disease. There were other stressors that came into my life that just exploded it. exploded it. But I had weaned myself off of birth control at a certain period of time. So, their belief system is like, so the birth control acts like a steroid. So basically suppresses everything. And then when you get off of it, it's like their idea is, well, it's just going to start growing again. And so that was the thinking, that it would just came back, but it was more the triggers, all those triggers that just set everything off again.
I think
And surgery.
I think we should be clear because you came through a lot. You did endometriosis, you got over it. Lyme disease, you got over it. IBS. We're not saying that the plant-based lifestyle solved all your problems on its own. So can you speak to
No,
that? Because people need to understand that we're not saying
yeah,
everything is solved just by the food you're eating.
no, 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 absolutely not. I mean, the food is one part, and it's an important part because what you put into your body creates your body. So if I'm going to keep eating things that might be more pro-inflammatory in my body that may feed the problem, um, so it can't just be food. So I couldn't just be on a vegan diet and think everything was going to go away. So sure, what did I do? I definitely did. At the time, I was also doing like acupuncture a little bit for a period of time, but nothing was actually making me better. It was more for symptom control at the time. So it was just really, really symptom control for me. And it was really not until putting in herbs. Like sometimes you need to use like herbs that are very antiviral and anti-inflammatory, and using foods in a certain way. Like, so you're really putting it in, not just saying, okay, I'm on plant-based now, but doing it in a very systematic way to help yourself. But I also did so many types of different therapies, but really what took it to another level was doing this plant-based diet, but also following with supplements and herbs, and looking at my body and looking at stress, and where were the stressors in my life, and what was causing me so much stress that was taking me down as well.
I think a lot of our clients have experienced the same thing because they come to us and they say, I've been plant-based for 2, 3, 4 years and I had a lot of great progress. And then they either hit a plateau or they started to
Yep.
regress again. And usually it's stress induced or car accident or loss of a loved one, right? Like all of these things. And then we have to say, okay, what other lifestyle factors or what other tools in the tool belt do we have that we need to add together with it? Because the more inflammation you're putting on and the more stress you're putting on your body through the foods you're eating, the less healing you have left in your body to take care of everything else that's been going on for 5, 10, 15, 20, 50 years.
If your adrenals are running and you're stressed, and it's very, very, very difficult to heal on, no matter what diet you're eating. So, and then one of the things that one other point I would say is that a lot of people who do plant-based, they're not necessarily, a lot of times when I fell into this trap of eating way too much fat, like I was eating so much fat when I first, because I was like, under the guise of like fruit being bad and not what I needed. And that was going to cause more inflammation because that was what I was taught early on. And so I was doing a lot of greens and a lot of fat and a very little fruit. And so when I flipped that to doing less fat and more fruit, and I was always doing lots of veggies, but that really made a big difference.
It's also some of the processed foods as well. So sometimes it's not only, what you're remembering to eat, but it's what you're also adding into there too. And I think a lot of people do it not really subconsciously, but they don't even realize that they're doing it. You're putting some pretzels in a bowl for a child and ooh, you're eating some, or you're getting meals ready and it's going down the hatch and things like that. So sometimes you don't even realize all the other things that are going on. And when you start to be mindful of that, I've had people say to me like, I didn't realize that I ate like as much food as a full meal while I was cooking dinner and then sat down to go and eat dinner again.
Agree. And that's one of the reasons I do a food log. Have people before they see me is they do a 5-day food log and then most people say to me, that was just a really interesting experience because I don't normally, and you pay attention in a different way when you're logging your diet every day, whatever you eat and whatever you drink. So it's different.
So just going back to Lyme and endometriosis for a minute, are those diseases that you can clear yourself of completely, or is it just a remission state?
No. So it really depends on how far along somebody is and what other, how much toxicity somebody has in their system. Everybody's different, where it takes, things are reversible and you can heal. I do believe you can heal Lyme, and I do believe you can repair the nervous system. It does take time. So nothing is a quick fix. So that's where people, I find a lot of my job is being a cheerleader to like keep people going, because they can get frustrated because they're not getting back better fast enough, because people do want quicker fixes. And this isn't a quick fix at all. And so, but yes, I do think people can heal from endometriosis, absolutely, and from Lyme disease. It's not really thought of in that way in the medical community, but you really can.
So neither is diabetes, but I think that's getting a little bit more mainstream as well.
You talked about the importance of figuring out the root cause to these issues, and we talked about inflammation briefly. Is inflammation, in fact, the root cause to so many of these issues?
It is the root cause, but what's causing the inflammation, right? So it isn't necessarily just a bad diet. I mean, really, the diet, certain foods might be feeding whatever's causing the inflammation. So inflammation is just this word, that means redness, swelling, heat, in the tissues, right? So what's really driving that? So that's why, like, you can come in with like chronic back pain and the doctor says, well, yeah, your back is inflamed. Okay, well, what's causing that inflammation? Is it an injury? Is it something structural? Or do you have some sort of low-grade viral infection in your body that you've had for years and that you didn't even know, that's still caught running and causing like a drain on your immune system, and there's also more inflammation at the same time. So that's why looking and finding a root cause is everything.
And for some people, the root cause is something that's continually happening to them. And for other people, the root cause is something that happened a long time ago. And there's a lot of talk around Epstein-Barr and that as well. Can you speak to that at all?
Absolutely. So that was really a big piece for me as well, because I actually didn't know that I had strep throat a bit when I was a kid, but I also had it more as an adult as well. But Epstein-Barr was something I got myself tested for. And sure enough, I had what's called, it's seeming like an old infection. Doctors will just tell you it's remission, but that's actually not true. So that you do have Epstein-Barr, you can look at your titers and you can see that they're at a certain level, and that is causing some inflammatory component of the body. So that could be affected it'd be causing so many different issues for people, because there's many, many more strains than what we know about from medicine. It only can test you for a few strains, but there are, many other strains that list out, are there that are causing other conditions, inflammatory conditions in the body.
So then how do you be your own advocate and guide your doctor who might not know about this or might not know what to test for? How can you be your own advocate?
Yeah, I think that's a great question, because for me, it is about empowering the patient to really be their best doctor and to be an advocate for themselves, so that they're educated, so that they don't go into an appointment and they get rushed in, rushed out without really really understanding what's wrong. But I always encourage patients to ask a lot of questions as much as they can, and also to interview your doctor. If this person is not right for you, then you got to find somebody else who won't rush you out or who's not going to answer your questions. So you can absolutely say, would you please test me for Epstein-Barr? Can you run a panel for me on Epstein-Barr, on cytomegalovirus, on any HHV6, on any herpetic virus that you want? And there are some that'll say, I don't understand why you want to do that, and we don't need to do that. But there are other doctors that are more curious and will let you do that, and will test. And at least it's not going to tell you everything, because, you know, it's only what's circulating in the blood. And we know that viruses can get into the tissues and you can't actually test for that. So it's, at least it's something. Sometimes, you know, when a patient sees something and I looked at mine and I was like, wow, look at this. Like my Epstein-Barr titers are very high. And my functional doctor, who I was going to because I wanted to have some feedback, was like, oh, it's an old infection. Don't worry about it. You just have antibodies. And so, but that's actually not true.
So I find that surprising because you'd think that the functional doctor would be more on top of it than, you know, your regular mainstream doctor as well. So you've really got to continuously just try to find the right person, take those results with you, find the right person, and hope your insurance company doesn't get mad at you along the way if you're down in the States. But so when they find that, then what?
So when they find that, that's when you know, if you're not really educated on this and you don't know where to start, it's basically, you know, if you can find a practitioner. The other thing is that, you know, Anthony William writes a whole books on, you know, Epstein-Barr. Basically, there's so much in there. And you can get started on your own. You know, you can get started on to change your diet, to work with certain herbs, to, you know, start to change things on yourself. There's plenty of people that can do this on their own, that really start to work with diet and nutrition, because there is so much information now to understand. I usually see the people who plateau that you're talking about, who've really done this for a while, and they get themselves to a certain place and they're stuck and they just can't move any further. And they don't know what's missing. And that's when, you know, my practice, I can come in handy, or any other practitioner who does something like this.
Yeah, I think there's no more important time than right now for people to start taking more responsibility for their own health and wellness. We could see what's going on in society, and individuals just really need to start paying more attention to everything around them and to what they're doing to themselves, whether it's stress or it's food or it's lack of exercise and becoming more sedentary, or just a way of life, lack of sleep. There's so many aspects to our health that we need to become more accountable and responsible for. So I think that's a really great message, and thank you for that.
Absolutely. I think, you know, I think it's really important for people to know how to support their own immune system, right? What are we in right now? So we're in a really tricky time. And if you can really understand how to use food as medicine and how to really support your own immune system, and like you said, do your research, because there's a lot of things out there that are not actually telling you what's going on.
So for those either newbies or oldies out there, what are some actionable tips that you could leave people with today that maybe they could start taking their health into their own hands a little bit more?
Well, I always say, you know, such an easy, simple thing for people to start with is like hydration. And so I love to start people on lemon water when they first wake up in the morning, because it really helps to flush the system. You detox when you sleep. It really supports your liver. So it's kind of like hydrating, giving yourself some vitamin C and some minerals right when you first wake up, before you decide you're either having that cup of coffee or whatever you're eating or drinking, that you just hydrate yourself first from the night before and flush with some lemon water. That's number one for sure. And people really don't pay attention to how much they're drinking, and they don't realize this more of a chronic dehydrated state that they're in with the foods that they eat, and what things make you more dehydrated and what foods are more hydrating. And so water is definitely up there, tops.
I think there's three groups of people when it comes to water. People who definitely hydrate themselves enough, people who know they're definitely not hydrating themselves enough, and then the people who fill their water bottles every day and it sits next to them and they have the best intentions. It just doesn't get down.
Right, because we get distracted and we're busy. And I've had some people like set an alarm on their phone just to remind themselves, like you remind yourself to get up and walk around, or to get up and, you know, just have a nice glass of water.
Yeah, there's even
Absolutely.
water bottles that light up and flash. Yeah. Remind you.
Yes. Remind you. And the other tip I always encourage people who are even just trying to eat more fruits and vegetables, more fruits and vegetables. I say, have a salad. Can you have one salad a day? Like whether it's at lunch or whether it's dinner, just one salad, and put some tomatoes and cucumbers and carrots and radishes and things like that. And so that's simple, like something that's basic that you can say, okay, I could do that.
Love that. That's
It's
great.
great. Yeah. Dr. Greene, thank you so much. Great information, great tips at the end there. Really appreciate you joining us on the Plant Trainers podcast. If our listeners want to reach out and connect with you, where would be the best place for them to go?
Sure. They can go to my website at Dr. Sherri, Sherri, Greene with an E at the end.com. There's also, if you scroll to the bottom, there's on the footer, there's a link to an immunity guide, and it's a great guide with a lot of tips how to support your immune system. So that's for free download. Or they can find me on Instagram at Dr. Sherri Greene, and I'm on Facebook at the same place. Those are the three main social media, things to find me.
Perfect. We will link to all of those in the show notes at planttrainers.com. Dr. Greene, thank you so much for joining us on the Plant Trainers podcast today. So much good information. I think that it's going to be enlightening and have a couple of people really think about what else they need to do to take their own health into their own hands. So we thank you so much for your time and expertise.
Thank you so much for having me here. It was wonderful.
Thank you so much. That was great.